Hello and welcome. Today we have an educational webinar on non-surgical hair restoration using platelet-rich plasma for androgenetic alopecia with Dr. Jeffrey Rapaport. Now, my name is Craig Ewan. I'll be your host today. That's a big, long one. But today you're going to learn everything you ever wanted to know about non-surgical hair restoration using platelet-rich plasma. So, good morning, Dr. Rapaport, and thank you for joining us today on this educational hangout.
Thank you for having me, Craig. Good to see you.
Now, I'm probably your typical candidate when it comes to, you look at and we'll get more into me because I'm probably a good example to refer to with my balding patch here. So this is going to be a really interesting educational webinar because I'm interested in the subject of hair restoration and all the different options that there are out there. And as indeed on these webinars, we always talk about what are all the different options available. I think first of all, on my question list is, what is androgenetic alopecia? To start, what is that?
Androgenetic alopecia is basically inherited alopecia. It's common mainly in men, and it is common in women. The ratio is about 70% of the men will get some, and about 30% of women. In women, it can be seen as a diffuse thinning of the hair, and it can also be a pattern where the center is lost. In men, it looks more like losing of the crown and losing of the frontal hairline and thinning of the hairline. As people age, almost every man is going to have some degree of androgenic alopecia, which is basically aging type alopecia.
Okay. So when you look at all the ads that you see on television, if you look at the hair restoration market as a global market, there's non-surgical routes, there's surgical methods, there's many different methods out there. Where does this particular non-surgical method using platelet-rich plasma fit in with all those other options, surgically and non-surgically, out there and available? So let's just investigate the different options of hair restoration out there. Where does this particular treatment fit in?
Okay, let me first start with the surgical restoration. The surgical restoration has come a long way now, and people do individual hair restoration, follicular transplants. There are lasers that enable you to take out one hair at a time from donor areas and put them into the scalp. The results, if in the right hands, are fairly natural, and the results should be permanent because the donor area is usually from an area that's not, that one doesn't lose hair from.
Right.
I've seen a lot of very good hair transplants. I've seen a lot of so-so hair transplants, and the key is the operator and how well they do it and how good the donor area is. For some people, they can't get enough hair because the donor area isn't thick enough. For some people, the result isn't fantastic because the operator doesn't particularly know how to make it look anatomic or natural enough. But I have some very good friends who are in the surgical hair restoration business, and they do a very, very good job. Now, as far as non-surgical hair restoration, I really wouldn't call it restoration until we've gotten to this new topic that we're discussing today. In reality, the topics, the means to keep your hair, and that's the whole key. You're not really restoring the hair too much when you use the non-surgical methods. For instance, minoxidil came out. It's been out for a while. I've been using it for a while. They say it's very good on the crown of the hair. It also works on the frontal part of the hair. But the reality is only a small percentage of people with minoxidil will regrow hair. Most of them will retain the hair. So they call it Rogaine. The real name should probably be Retain. because it
Right.
doesn't really make the hair grow back.
So it's these types of topicals then are ideal if you start seeing your hair starting to disappear. You best get onto the topicals quick to try and retain what you have. That's what
Right,
you say.
and usually it started with fairly young people when they in their 20s. There are some side effects. The main side effects being people don't like to have either the greasiness or they get irritation from the product. It's messy, etc. So it's hard to get people to use the product really twice a day, which is the intended application. So Rogaine, I think it works. I think it works good at retaining. I think it works better in women than it does in men. But there's some people that just don't like doing this twice a day. For those people, actually, I tell them to do it once a day because once a day is better than twice a day. The second thing that is out there that a lot of people are using is something called Propecia. Now, Propecia is now a how do I say it? It's a little bit suspect for some people because we're starting to see side effects on Propecia. For instance, some people are noticing decreased sexual libido. Some people are noticing decreased volume of ejaculate when having sex. So finasteride, which is Propecia, doesn't have the same glory or the same luster that it used to have because we're starting to see the side effects. And I have people that come into my office that say, I don't want to deal with this because I don't want to take a chance of decreasing my sexual libido. I don't want to decrease my volume of my ejaculate, and I really want to stay away from any pills to take.
Okay.
So the finasteride works very well also at retaining hair, growing a little bit here, and I think you combine, you know, this is this is the way of the future with all medications is using the right combinations, and people are combining finasteride with Rogaine, and they're getting, and that's what I was doing, and I was getting pretty good results. I would, I was retaining my hair pretty well, but I still had some bald spots. But compared to my father, who had severe androgenetic alopecia, I would think I was doing fantastic. All of a sudden comes along a new non-surgical hair restoration that I was researching and that I read about, and it sounded so good that I actually didn't believe it, Craig. It was just, I said, this thing cannot work the way they say it works. And I read an article by the first article that appeared in the Dermatologic Surgery Journal, and that's the gold standard for peer-reviewed journals in dermatology. It's the Journal of Dermatologic Surgery. For the first time, ran an article last month on using platelet-rich plasma for androgenic alopecia. And it was an interesting article because it had never, a lot of the different throwaways had mentioned it, but it was never an article in a peer-reviewed scientific journal that I had read. I know that my hair transplant colleagues have known about platelet-rich plasma, and they have put the actual transplants that they were doing and letting them soak in platelet-rich plasma to get the transplants to be thicker and to come back quicker and to get a better take. But there was really no scientifically oriented peer-reviewed study that talked strictly about the platelet-rich plasma for androgenic hair restoration. So I read the article with much glee because I was very interested in it, and I want to summarize the article to you. They did 64 patients in Italy. It wasn't done in the United States, and out of those 64 patients, observers found that 62 of the patients got successful results. 62 out of 64 got improvement, and when they reviewed the improvement, they said that around anywhere from 40 to 60% of the improvement was substantial. Now, to me, that's really pretty wow results. Yes. And it just so happened that I had read some minor articles or articles in throwaway journals before, so in our office I said, this stuff is too good to be true. Let me pick a couple of my patients, explain them all what's going on, and see if we can duplicate some of the results. Now, I want to say right up front that this procedure is not FDA approved.
Okay.
And it's not FDA approved. The only thing that's FDA approved is the ability to produce the platelet-rich plasma. That part is FDA approved, and it's the way the platelet plasma is obtained is you draw some blood and you spin it, and it's really not very complicated.
All right.
So the concept of spinning the blood and centrifuge, etc., is FDA approved, but the concept of injecting the platelet-rich plasma for anything else has not been approved. Now, you may have heard of orthopedists, rheumatologists, plastic surgeons. I know that you live in Miami, and Miss Kardashian went down to get the so-called vampire facelift or vampire.
That's right. Vampire facelift, yeah.
It wasn't a facelift; it was a vampire facial, and all of that. And that basically is a facial with platelet-rich plasma. So it's being used all over in various different specialties for all different things. And a lot of my colleagues in orthopedics say that it works so-so. It really works best for tendinitis. It doesn't work for everything. A lot of very famous people, including baseball players, that 2 years ago left the country to get this done with different orthopedists. So I was very interested to see, now we had a bona fide, peer-reviewed article that appeared in one of the journals, and I wanted to see in my own office if it really worked. So what we did was we selected about 20 of our patients, and initially we mainly had males because it is about 70-30, and we explained it to them. We explained that it wasn't FDA approved. We explained that there were articles and would they like to try it. And the results have been quite remarkable. It's been remarkable to the point that I could not believe the results. It's not a home run in everybody, but almost everybody gets improvement when you get with the PRP injections. And it's something that it sounds like it's too good to be true, but it actually works. And I brought some slides of a couple people, not only the best ones. I brought some average ones. I brought some pictures. Once again, when I heard about it, I figured, let me try it myself. I'm losing hair in the crown of my head. Let me see if it works. Let me see if it works for me too. So I think your listeners will get a lot of information by just seeing the before and after results. Most of these results are after 3 months of treatment. Every doctor has their own way of treating. This is after 2 treatments, and we evaluated at 3 months. This is a gentleman who had some previous hair transplants in the front, and this is his before and afters. And he's ecstatic. He actually has a significant amount more hair to grow, and now he can comb it over in the front. What I want to point out to you, if you'll notice that the back of the hair has not done as well as the area in the front, and it's my feeling is, even though the doctors in the Italian article did what was called microneedling on the back, where there was a shiny bald spot, and they felt that they got some hair growth. In our experience, because I did the microneedling, when you have real shiny with no open follicles that you can really see, it doesn't really work as well as it does where there are follicles. And you can see in the front where he does have follicles and a few transplanted hairs, they took pretty well.
So what you're saying is if you've had a shiny bald head for many years, then it's not going to grow new hair back, is what you're saying. Let's put it to you this way. I don't think you're going to get a significant amount. You may get some little fuzzy hair growth,
but you're not going to get significant hair growth. And if you look closely under a magnifying glass, you're going to see in the back there that a lot of the follicles are not open.
Right.
And when the follicles aren't open, it's very difficult to get the hair to regrow.
But in this case we're looking at, there's a dramatic improvement on the front. Definitely.
Yeah, I know, because that's where he had the open follicles. If you look at it closely, he's not as shiny on the front, and he looks so much better. He was supposed to come in this week, and I was going to give you an updated picture, because the last time I saw him and we didn't even do a treatment, he's got enough hair that he can actually comb his hair to the side.
Wow, wow. Let's have a look at, incredible. Let's look at this one.
This is a young man that was a little uncertain about doing the treatment, and these pictures are at 3 months after the first session. Different doctors do the sessions differently. We have a separate protocol that we use in our office. The protocol that was used in the article, it was one of they did a treatment once every 6 months. We do our protocol a little bit differently, and I think that we actually get better results than what I saw in the article. But I can't compare completely because I don't really have all of their before and after pictures. But this young man really got a very, very nice regrowth. There's only, if you'll notice, and this is the same thing I noticed in myself, the width of the bald spot in the crown starts to move in from the outside in. And
yes,
what it does is it recruits hairs on the outside, and they keep getting smaller and smaller and smaller in terms of moving closer. And the study did teach us that there's 3 things going on. One is that the hair growth in the anagen phase, which is a growing phase, stays longer. The second thing, which is important, is that the hair becomes thicker. The individual hair becomes thicker. And then the third thing is that you can get hair growth where there hasn't been hair before, and that's the one where I said it's a little bit more hit or miss.
Well, that's a dramatic impact on the crown there, definitely, for that chap. Well, let's have a look at this one.
This gentleman drives a pretty long distance to see me, and he's at 3 months after his first session, and he has filled in significantly his crown and the front part. He never really had much on the front part. We did do the needling for him because he wanted to get the front part. And the thing that I find so amazing about this photo, and if you look closely, there are new hairs that are grown, and his hair is predominantly gray, but if you look at those small hairs, they're black. He's growing in black hair, which leads us to believe and understand why the PRP works, because PRP has growth factors in it, and it releases cytokines and probably does something with the vascularity. And to be able to grow black hairs, to me, this was just phenomenal in terms of an observation.
Right. Well, definitely, I can see that there. All right, this chap.
This chap is the chap on the other line with the hangout with you. And the left was before we started. I was going to start in my.
So this is you.
This is me, and my my office manager said, we got to take pictures of you before we start too. So my picture on the left is before, and the picture on the right, which is about 3 weeks old. If we took a newer picture, it'd be even better. But what I want you to notice is, for people that have this balding spot, that the hairs are starting to grow in from the outside. In other words, the outside of the bald circle is starting to get smaller and smaller, so it's moving, the top is moving down, the bottom is moving up, and the sides are moving towards the center.
Yes.
And the other thing that you'll notice is that there are some more hairs that are growing actually in the center.
I see that. Would the expectation with these, Dr. Rapaport, of any of these examples, is the expectation, like yourself as a candidate, to actually fill in that whole crown area? Would that be an expectation?
The expectation is a lot related to the patient also. I'm convinced that there is only a certain amount of hair growth that you can get. I'm not convinced that everybody can get everything completely filled in, but I don't know yet, because the first article just appeared. We are probably 5 months into treating our patients. We have seen people who are that picture was about 90%. I don't know exactly whether it's going to completely fill in or not, but I do know that there will be significant improvement. So the answer is still to be determined.
But you're going to take pictures at predetermined stages with all these patients, including yourself, to at least see the progress. That'll be interesting to see.
We take pictures every time now, and next time as a follow-up, we're starting to do women. The thing with women is that women are much less likely to let you use their pictures, but I'm going to see if we can shade out some faces, etc. I have done, and I know we can use it, a lady who works in my office, on her temporal area, which is the area in here. She was almost completely bald, and after 1 month, we can see that she's starting to get hair regrowth. Now, it's amazing to me that at a month to 2 months, we're already seeing results. The article said they didn't see anything for 4 to 6 months. We are seeing results in a month to 2 months.
So those examples, by the way, are phenomenal. So it'd be interesting to have this same discussion in 3 or 6 months' time to see those results, the additional results on yourself and these other candidates here. But so women and men equally, not a problem. Both are candidates for this particular treatment.
Women and men are both candidates. What we have to be able to do is separate people that have autoimmune hair loss. There are people that lose hair from lupus, from rheumatoid arthritis, things like that. Because what will happen is even if you get the hair to partially regrow, the autoimmune phenomenon is going to come in and knock it down or remove it. So we want to make sure that we're not treating people with autoimmune diseases, also alopecia areata. But the person that I did treat with traction alopecia is a type of hair loss from people who keep pulling on their hair. The young lady in my office had traction alopecia, and when we get to do the next set of photos, I'm going to show you that traction alopecia, it did work. So we want to avoid autoimmune diseases for now. I don't, I have a bunch of people with autoimmune diseases. I don't think anybody has even tried them. I think that for right now, that's what we're avoiding because we know we're doing well with the other one. At some point, I may start and treat 1 or 2 people and see if we can get some results.
Okay. Right. Well, let's from a candidate point of view, what I'm interested in is who is a typical candidate for this type of treatment. So let's look at my average middle-aged guy, mid-40s. I started balding and losing my natural hairline probably early 20s. I didn't do anything about it using any of the topicals or anything to try and stop the loss and try and retain the hair. I did nothing, which is obviously the first stage that people can get involved in. But if you look at me, which I think I do have, I can't see the back, but I think I do have loss on the crown, but certainly this front area that just seems to keep going back and back and back every year. What would if you were to look at me as a typical candidate for this treatment, what would you be telling me in the way of maybe my expectations, which maybe I'm a typical 80% of people out there, I don't know, that would probably benefit from this treatment?
I don't like to make predictions, Craig, and the reason is because, and I say this almost every time that we talk, anytime that you have any procedure, you can do the procedure the same way 100 times and everybody's going to react different. What I can tell you is whether or not you would be a candidate and what I have seen. And as long as you have hair that is growing or hair that is there, you are a candidate. So as far as the frontal part of your hair, we can treat your hair. What would I expect to see? What would I hope to see? I think we can get that front tuft to widen out, and we can get it to blend more to the back so it doesn't stick out so much. As far as the back of your hair, I don't really know what you have growing there, but if you have some fine hairs or you have some decent hairs back there, then we think that we can get those hairs to thicken, and we think we can get them to combine with the hair, with the peripheral hairs, and have that move in. So as long as you're not a cue ball, or as long as you're not you do not have a head that is really shiny, we can take the hair that you have and hope that we can expand and get the hairs to grow thicker and move wider and give you a more fullness from what you have.
Excellent. Got it. Now, what are the expectations of how long the results will last? I mean, just if you can just let me know, how long would the results last from the treatment, and how many sessions of treatment is there? Do you have multiple sessions? Is it a one-off type of session? How does that work?
Well, once again, this is uncharted territory, and nobody really knows the answer, so I'm going to tell you that it's mainly speculation.
Okay.
We know that androgenic alopecia is like rolling a rock up a hill. If you stop the treatment, the rock is going to come down the hill. We know that from the non-invasive type things, which is the Rogaine or the Propecia, that you have to continue that, and if you stop it, that you're going to end up going back to where you were. So the expectation is that you're going to probably need to continue the treatments. The question is then, how often are you going to have to continue the treatments? My speculation is, according to what the articles say, that you will probably need to do, once you get your initial growth to the point that you're happy. And the way we do it in our office, we have our own way of doing it, but I think what we do is we go into the point where the patient is fairly happy with what they have, and then we go into a maintenance phase. The maintenance phase, I think, is going to be probably 2 times a year you're going to need to come and get a treatment. So once you get to the point that you're satisfied with the amount of restoration that you have, and everybody's different. I mean, if you decide that you only want a little bit, or somebody else wants everything as far as we can go, everybody's got their own expectations. So if we can take it to the point that we meet your expectations, I'm anticipating somewhere 2, maybe 3 times a year you have to come in and have a treatment just to keep things the way they are. Right,
got it. Now, just following on from that, obviously there is a maintenance program with I'm just trying to weigh up the surgical options against the non-surgical, just trying to be non-biased to either.
Well, I think that's very important, and the surgical options do not need to be repeated, because the surgical options, they take the donor sites. It's that's funny, right. Dr. Norman Orntreich is the one that discovered that if you take a transplanted hair from an area that you were not going to lose your hair, and you put it into an area that you do lose your hair, the characteristics of the hair maintain that of the donor site. So when you take hair from a donor site and you put it into where the hair would not be lost, and you put it into an area where the hair would be lost, it stays because it retains the characteristics of the donor site. So the beauty of surgical hair transplantation is that you don't have to repeat it. After you lose a couple hairs, and there's always a couple hairs that are lost, and that's the reason that some of the surgical guys are using PRP to get the take to be higher and for the hairs to be thicker, those hairs will last. The hairs that with the non-surgical restoration have to be maintained just like any other hair maintenance with Rogaine or Propecia. My feelings are that eventually, if you stop doing the platelet rich plasma, that you're going to go back to where you were before, or probably going to go back to where you were at your present age, meaning that if you do it for 5 years and you stop, you're going to end up going back to where to 5 years beyond where you started.
Right. Okay, got it. Excellent. Well, you've certainly answered all my questions today, Al. I've seen the before and after pictures. I found it very educational in terms of I'm a typical candidate looking for different options out there, so it's always interesting to hear all the different available options that there are. Do you have anything else to add in terms of anything that we've missed, or any of the questions that I've missed? Any particular information you'd like to share that I missed asking?
Well, you know, this is a work in progress, Craig. There's right now not that many articles out there, and I don't know that many centers are doing the studies. And the reason that that's happening is because there's no drug company behind this. I mean, it's not, and the reason it's not FDA approved is because no drug company is going to spend between $5 and $10 million that you have to spend to get this approved. I think eventually somebody may try to come out with a kit that will do this, but this is a work in progress. And all the questions that you asked me, how long is it going to last? What's the best treatment method?
Yeah.
What areas respond the best? What patients can you not do? What is the patients that we can include? What diseases will respond? All of these answers will be forthcoming, but we don't really know them as of yet. I have ideas, but those are strictly ideas in my head that I'm, you know, hypothesizing about. All of this information will be coming out, and you're going to start seeing this coming within the next year or two. This is going to come out in a very, very, very strong way. And I think you'll follow my prediction. I think that within the next 5 years, that there's a significant percentage of people that were considering hair restoration surgically that are going to skip the hair restoration surgically and are going to be doing the non-surgical restoration. As a matter of fact, we just had 2 people in my office this last week who were considering going in for another round of hair transplants that said, let me try this first and see how it's working. So there are advantages for hair transplantation in that it's permanent. I'm not saying that this is going to replace hair transplantation. I think it's going to probably be used with hair transplantation. I think that transplant surgeons are using this together with their hair transplants, but this is all a work in progress, and the information is going to be coming fast and furious over the next couple of months to years.
Well, I'm going to be following the pictures. I'm going to be following your progress with your patients. I'm going to be looking at your website. I'm going to be checking out those. If you put up those continual changes in the images, I'll be interested in seeing those. So yeah, I'm going to be watching and keeping a close eye too. It'll be interesting to see the development and progress of this technology. Well,
this technology is very new, and that's why I felt that this informational video would be very, very important to your listeners and people that follow me, because it's so new and it's so cutting edge that there aren't that many places that you can reach out and get the information. And I think that people who like to know all the new nuances in terms of cosmetic procedures and dermatologic surgery will find that this field is growing very, very fast, and it's terrific. And as I said, I just couldn't believe it the first time when I saw it. But it's real, and it's happening, and I'm glad that we have it around.
Excellent. Well, thank you very much for sharing your advice, your insights into this technology, Dr. Rapaport. I appreciate your time today. Thank you.
Well, it was a pleasure being here as always, and good to see you.
Okay, thank you. Bye-bye.
Bye.